Now that we've discussed how MCAS is diagnosed, let's talk about the typical treatment plan offered by the centralized healthcare system. When someone is diagnosed with MCAS, the most common approach involves medications aimed at controlling symptoms by blocking the release of chemicals from mast cells or reducing their effects on the body. One of the first lines of treatment includes antihistamines. These are medications designed to block the effects of histamine, one of the main chemicals released by mast cells during a flare-up. Antihistamines can be divided into two categories: H1 blockers and H2 blockers. H1 blockers, like loratadine or cetirizine, are used to reduce allergy-like symptoms like itching, hives, and sneezing. H2 blockers, like famotidine or ranitidine, target the digestive system and can help with symptoms like acid reflux, nausea, or abdominal pain. For many people, using both types of antihistamines helps manage a broad range of MCAS symptoms. The next type of treatment commonly used is mast cell stabilizers. These medications help reduce how often mast cells release inflammatory chemicals like histamine. One of the most widely used mast cell stabilizers is cromolyn sodium, which can be taken orally to help with digestive issues or in inhaled form to help with respiratory symptoms. Another common mast cell stabilizer is ketotifen, which can be prescribed to help control both allergic and non-allergic symptoms by calming mast cells and reducing their activity. Personally, I was taking the maximum dose of both H1 and H2 blockers, along with cromolyn before every meal in an effort to control my symptoms. While these medications did help in some ways, they also caused new issues for me. I experienced additional symptoms like constipation, dry skin, and fatigue, which became frustrating side effects of the treatment that was supposed to help. At one point, I asked my allergist how I could reverse MCAS, how I could actually get to the root of the problem and work towards a solution. He looked at me with a blank face and said something along the lines of, "Oh no, most people take these medications forever." There was no attempt to identify a potential cause, no discussion of other approaches, just the assumption that medications were a permanent part of my life now. In some cases, patients may be offered more advanced treatment, like injections to control symptoms. One example is Xolair, which is an injectable medication used to block the effects of IgE, which is a key player in allergic reactions and mast cell activation. Xolair is often prescribed to help people with severe allergic asthma or chronic hives, but has also been found to help reduce the frequency and severity of MCAS flare-ups in some patients. This type of injection is usually given on a regular schedule, such as every 2 or 4 weeks, and is meant to keep the immune system in check and reduce overactivation. While these medications can help reduce symptoms and make day-to-day life more manageable, it's important to note that the goal of the centralized healthcare system is usually symptom control, rather than addressing the root cause of MCAS. Many people who follow this treatment plan find that they need to stay on medications long term, and the treatment primarily focuses on managing flare-ups rather than preventing them from happening in the first place. In summary, the common treatment plan from the centralized system typically includes a combination of antihistamines, mast cell stabilizers, and sometimes injections like Xolair to keep symptoms under control. While these treatments can be effective for symptom relief, they don't usually address the deeper cause of the condition. In future videos, we'll explore other ways to manage MCAS symptoms, including lifestyle changes and holistic approaches that can help reduce your reliance on medications and improve your overall quality of life.